In this video, we are going to briefly discuss some skeletal system disorders. Because intervertebral discs are shock absorbers, they're constantly being compressed. If the anterior and posterior ligaments of the disc become injured or weakened, the pressure develops in the nucleus pulposus, remember this center part. The pressure might be great enough to actually rupture the surrounding annulus fibrosus. If this occurs, the nucleus pulposus may herniate or protrude. The nucleus pulposus might herniate posteriorly or onto one of the adjacent vertebral bodies. When this occurs, it is called a herniated disc, as you can see in this picture here. Frequently, the nucleus pulposus slips posteriorly toward the spinal cord and the spinal nerves in a herniated disc. And this movement exerts a pressure on the spinal nerve. So you can see here, we're going to be putting pressure on this spinal nerve. And this causes local weakness and acute pain when we're going to put pressure on those nerves and kind of cutting off the nerves there. There are a couple of different conditions that may exaggerate the normal curves of the vertebral column, or the column may acquire a lateral bend. So these would result in abnormal curves. The three main ones that we are briefly going to look at are scoliosis, kyphosis, and lordosis. Scoliosis, the first one here, this is the most common of the abnormal curves, and it's a lateral bending of the vertebral column, usually in the thoracic region, as you can see here, where the arrow is, that lateral bending in the thoracic region. It may result from congenitally. Congenital means from birth. It may be from malformed vertebrae, chronic sciatica, paralysis of muscles on one side of the vertebral column. This can also result from poor posture or one leg being a lot shorter than the other. Next, we have kyphosis. The prefix kyphos actually means hump. And this is an increase in the thoracic curve of the vertebral column that produces this hunchback look. In tuberculosis of the spine, vertebral bodies may partially collapse, causing this acute angular bending of the vertebral column. Kyphosis may be caused by degeneration of the intervertebral discs in the elderly, sometimes also caused by rickets, and also by poor posture as well. Rickets, if you've heard of rickets before, this is a skeletal disorder that's caused by a lack of vitamin D. Also calcium or phosphate as well. Rickets, this causes people to have weak or soft bones or skeletal deformities as well, like kyphosis. Lastly, we have lordosis. The prefix lord means bent backward. That's bent. This is sometimes called a hollow back because we have that increase in the lumbar curve right there of the vertebral column kind of like a hollow back. This may result from increased weight in the abdomen, such as in pregnancy or in extreme obesity. This could also be caused by poor posture, rickets as well. Also osteoporosis or tuberculosis of the spine. These can all lead to lordosis. Spina bifida is a congenital defect disorder, so this means that it's present at birth, and this is where the laminae of the L5 and or S1 actually fail to develop properly. We can actually have pretty minor deformities of this defect. This is called spina bifida occulta. There's actually like no symptoms when it's that minor, or it can be very severe. Spina bifida with meningomyelocele. So in the latter case, in one of the most severe cases, this is where we have a protrusion of the meninges, or the membrane surrounding the spinal cord, and or the spinal cord through a defect in the laminae, and these are collectively called spina bifida cystica. And this cystica, this is because of the presence of a cyst-like sac that actually protrudes from the backbone. So there's what you have, this sac containing the meninges, the membrane covering the spinal cord, as well as the cerebral spinal fluid actually protrudes out of the back. So here we have a pretty severe case of spina bifida, and this is actually spina bifida with meningomyelocele, because it does contain a sac, because the protruding sac contains meninges from the spinal cord and cerebral spinal fluid. The larger the cyst and the number of neural structures that it contains, the more serious the neurological problems are going to be. So in very serious cases, there can actually be partial or complete paralysis in spina bifida. And that's going to be the end of Chapter 7.